Good morning to you all. Uh, I have a very simple task to discuss with you, that is the epidemiology of invasive fungal infection in Asia Pacific. When we have very little data from the Asia Pacific region, it is generally we can say that invasive, in case of this epidemiology, we know very little. These are my disclosures. First thing is that what is the really uniqueness in this continent? First thing, 30% of the world land area where 60% of the world population live, and here the economy, most of the countries are in the low middle income country, and health infrastructure is really suboptimal in this region. And we do stay in a place where there is more tropical climate, where fungi usually thrive easily. And with this scenario, what we see that, like suppose this was from the Gafi, they tried to look into what is the magnitude of the problem. In 8 continents, it had shown that nearly 2 million people suffer of this disease. So it's a very high magnitude of fungal infection which have been there in this particular region. And top of this, the challenge is we have a shortage of everything, whether it is in case of awareness, laboratory development, manpower, antifungal drugs, and even if it is available, affordability of antifungal is a big problem. So, whenever there is an outbreak happen, it happens in large number of people. You just imagine this was an outbreak happen of a particular fungemia of a fungus which is now called weaker hamomys, which is earlier called Pichianomonas, and you see that 379 babies suffered from bloodstream infection by the time we could really recognize and control this outbreak. The reason is in public sector hospital, we have got so many patients coming there. There is always some compromise in case of healthcare, and because of that, we see high incidence of invasive candidiasis. And in the environment also, we see large number of fungal spores. You can see that this is one study which showed that in ICU, there was a count of nearly 100 CFU per cubic meter in case of these fungal spores which are being present. And it is said that if you have got more than 25, even an healthy individual can acquire fungal infection. So here basic problem is we do have air conditioning, central air conditioning system, but this central air conditioning duct where it is getting colonized by this fungus is not covered at the patient end with a HEPA filter. And because of this, we see large number of spores which are being present. We also have seen that in case of this diabetes, which is very high in some of the countries, especially in India and China, and here compliance to the anti-diabetic therapy is very poor, and because of that we see mucormycosis rate very high. And as I have said, in case of tropical region where we do see many hyaline fungus and black fungus causing the disease. So invasive fungal infection is looming large in this continent. Second important thing, we see certain unique fungal species in this region. In the morning you have heard about Talomyces marnefi, which is restricted in the Southeast Asian region. There is another parafungus, it's not a clearly fungus, Pythium, which is very high in incidence in case of this Thailand. And in case of India, we have seen in case of the corneal ulcers, Pythium insidosum is very high. Black fungus, like suppose this particular fungus, Cladophila bantiana, brain abscess, is very common in case of India. Scedosporium and Lemanthospora, these are the two very difficult to treat fungus, is very common in case of Australian region. Somehow, amongst this Candida, now we have more non-albicans Candida species, and amongst this non-albicans Candida species, Candida tropical is very high in tropical region. Trichosporum species, some of this in case of the Japan, Thailand and Taiwan, it has shown that invasive trichosporonosis is very common. As I have already mentioned in case of mucor is very common in case of this region. Not only the Rhizopus aeregeus, which is the common agent in case of mucor, we do see many rare mucorales which have been present in this region, like mucor irregularis, producing skin lesion in case of China and India. These particular two fungus, Apophytomyces elegans and Succinia viciformis, both of these fungus had been seen to be very high in case of India, and of course in case of Australia multiple cases have been now reported. Rhizopus homothalicus, I am not sure what is the reason, it had been shown to be around 5% of all clinical isolates in case of India. Then there is very rare fungus like Thamnostylium lucknoense which have been seen in case of India. So you see that we have got a very unique epidemiological niche in this Southeast Asian region. So let's look into dimorphic fungal disease. What are the commonly we see? Histoplasmosis and mycoses. Blastro is very rarely being identified. Now mycormycosis is a new disease which is coming up. When you see this coccidiomycosis, that's very rare here. Doesn't occur here, but people now go across the world. Several people, they have, if somebody has visited, say, went to Las Vegas and coming up, your antenna should be high to pick up such type of cases. Like in case of India, what we have seen a patient who have gone around different hospital, after 3 years he had been diagnosed of coccidiomycosis. Only thing is that nobody had taken carefully the history of his travel. He acquired the infection. Luckily he survived 3 years to be diagnosed for this coccidiomycosis. So we have to have this travel history very important. Paracoccidiomycosis, only one case have been reported in this region from Japan, but that is again a patient who have been migrated from going into the Latin America. Histoplasmosis, I am just giving a bird's eye view in case of these certain areas where it had shown series of cases reported, especially in case of southern China and India, and in other countries of course it is being there. We know that histoplasmosis in HIV is a very important issue, but now we are seeing a lot of cases, non-HIV group, in case of immunocompetent individual acquiring histoplasmosis. And those individuals, they usually present either with adrenal tumor or sometimes presenting with the ulcers in the skin or sometimes in the throat. Mycoses. You see that there are 4 countries where it had been reported very high in number. I would say China having got the highest number, next is in this Thailand, then Vietnam, and in India it had been shown. In India, we see it is only in the northeast part of the country, not everywhere. So we still don't know what is the source of Talomyces marnefi, but it is expected that something from the soil we acquired this infection. 90% cases from the HIV, and it had shown now that with a particular genotype, polymorphism, which have been associated with it, 10% of them non-HIV group. And in this non-HIV group, specifically some of this HLA deer, where this specific polymorphism which have been seen in this. You know, this particular fungus, Emergomyces africanus, this is one of the important agents which is now in South Africa in HIV patients, quite a number of cases have been reported. In India, we found 2 cases, and if you see, it's sometimes very difficult to identify. You see, this particular histopathology might think about histoplasmosis, but then this particular fungus, when cultured, there is no tuberculate macroconidia which is being seen in case of this. Finally, it was identified as Emergomyces pastorianus. Now coming to the common agent like Candida. Candida we see compared to the rest of the world much higher in incidence, and in India we have seen in multiple studies sometimes 7 times, sometimes even up to 20 times. And when I looked into these different countries in this Southeast Asian region, you see Pakistan had got very high incidence, then Malaysia, Indonesia, Bangladesh, Vietnam, like this, the incidence in certain countries, it had been shown very high. As I have mentioned that Candida tropicalis is very common, and if you see, this was one of the study from our Asian fungal working group, which showed that Candida tropicalis in an average very high, but certain areas where it is in the tropical region, in this area where it is much higher in incidence. We did a study in India across 27 ICU, and what we have seen is that, sorry, what we have seen is that it is the Candida tropicalis which is the highest in incidence. And if you see, 31 species have been identified from the blood. So we need a good mycology laboratory for diagnosis of these cases. And what we are also observing is that there is an increased resistance to the albicans and tropicalis. If you see the IDSA guideline which was published earlier, that particular guideline has said that if it is albicans and tropicalis, you may not do susceptibility. But they have changed in 2016 guideline, because what is that been shown in case of albicans and tropicalis also, the resistance are increasing in number. Especially in case of the China, it had shown that even up to 42% resistant or susceptible dose dependent range which have been there. So everywhere we are seeing high incidence in tropical. In case of Candida auris, I am not very sure how much of you are aware of this particular agent. This started in 2008 from Japan and Korea. Then it had spread across the world, 43 countries which have this Candida auris outbreak. And when it had been looked into, in case of Asian country, 15 Asian countries where it had been there, and 10 of the Southeast Asian country where it had been present. When culture collection had been looked into, people maintained the culture collection where it had shown that it was not 2008, rather in 1996, first case was there in case of South Korea, then Japan, then Pakistan, then India. So you see that this particular agent which we need to identify, and because you see this is one of our study from India where it had shown that now in ICU, amongst the blood isolates, Candida auris has become the first rank in order. And another difficult thing is that this is a, these have got 4 clades, now possibly 5th clade is there. Genetically it had been found into these different clades, and of which most of our South Asian clade is in the clade 1. And clade 1 has got significance is that this is nearly 100% fluconazole resistant, 54% voriconazole, and 30% amphotericin B resistant. Even in case of India, we are now seeing around 10% resistance in echinocandid. So this is a very difficult bug to treat in that sense. We have seen also many rare yeast outbreak in case of the Southeast Asian region. And whenever it had happened, as I mentioned, so many number of patients who suffered because of this. Main problem is that we don't know the epidemiology because this is a very rare fungus. Second important thing is that it is difficult to identify. Laboratory diagnosis is a challenge. And third important problem is that we don't know what is the breakpoint. So what is the drug we should give? We are not very sure about it. So we need good diagnostic mycology laboratories in this region. Coming to the crypto. Crypto, I would say that another yeast which is very important in case of Southeast Asian region. The reason is, if you see, of course, Sub-Saharan Africa is the highest number, and next is, it is in case of this Asia Pacific region where the number of cases which have been there. Now we are also seeing crypto in case of immunocompetent hosts, not only in HIV, and in China it had shown that majority of their crypto is now from non-HIV rather than HIV, and what they have also shown certain polymorphism which have been associated with this group. And this group is very having high mortality because in case of non-immunosuppressed patient, we don't expect crypto. And by the time you diagnose, it might be too late. So here the problem is we don't have any guidelines till now. We have in HIV, there is a guideline in case of crypto, but not in this group of patients. Now coming to the invasive mold disease, one of the important study which again had been conducted from Asian Fungal Working Group, and it had shown that studies of 5 countries, underlying disease had been found to be diabetes, an important factor, then AML and other rheumatogenic condition. Here, what we have seen importantly, that Aspergillus fumigatus throughout the world is very common, except in case of the Asian region and African region, where Aspergillus flavus is equally important, and Aspergillus flavus is having comparatively more resistant in case of this compared to Aspergillus fumigatus. This is one of the study from our country, multi-center study, where you can see again A flavus is equal to A fumigatus. And what we have also seen is that mucorales is found to be in 25% of the cases. Australia, when there is a study voluntarily reported, it had shown that other than Aspergillus mucorales, they have got Fusarium and Scerosporium infection, which have been also been important. So invasive aspergillosis, when it had been tried to look into the continent-wise comparison, if you see, it is the Asia which have got the highest number of cases, and it is leading cause in case of the Thailand, Japan and Korea in the invasive fungal disease. Even it can be seen in case of immunocompetent host. Already I have mentioned about A flavus. If you see this comparison per 100,000 population data, it had been seen highest in case of China, Vietnam and Indonesia in case of this particular disease. I have seen that there are sometimes we see outbreaks of Aspergillus, and this has happened because of the construction activity. This is one of the outbreak in case of the Australia, where ultimately it had been controlled when the construction area had been covered or made it barrier from the patient area. That really helped in case of control of it. So Aspergillus as such is a very interesting fungus to produce disease. At one end you see that it produced the, in case of immune suppression, invasive aspergillosis. On the other end, if there is immune hyperactivity, we see allergic bronchopulmonary aspergillosis. That's another thing. And also severe asthma with fungal sensitization, which is called SAPS. SAPS is also very important. And if there is lung damage, we see chronic aspergillosis, chronic pulmonary aspergillosis, which have been commonly seen. So you see that in case of the ABP and SAPS, in certain countries where it had been shown much higher, like in case of Pakistan, Indonesia, Philippines, Bangladesh, even in case of the India is very high in incidence about this. Chronic pulmonary aspergillosis, and this is post-tuberculosis is a very important issue. A patient who have been treated on for tuberculosis, he had been cured, gone home 6 months after, he is coming back with similar symptoms. First thing we think whether it is a drug-resistant tuberculosis, or we start thinking whether it is a new tuberculosis. We never think that it can be small cavities get colonized with aspergillus, and this is being seen quite high in numbers, specifically in case of Indonesia, in case of the Nepal, Philippines, Bangladesh, this has been found to be very high in incidence. Now, in case of aspergillus, azole resistance is coming up, and especially in case of the Europe, the incidence had shown very high, and this has been linked with the fungicide used in the agriculture. Somehow, in case of the Asian region, still the incidence is not so high. We are a bit lucky in that sense, but we have the problem with Aspergillus flavus, which have got comparatively higher resistance. We have also seen that there are certain unique mechanism of resistance in case of Aspergillus flavus. Fungal rhinosinusitis, I am not very sure whether other countries in case of Asia, why they are not looking into it or they don't have the problem. But it is a big problem in case of India, which have been shown in case of this fungal rhinosinusitis. So when we did study in the villages of India, we covered nearly 70,000 population, where we have shown that 1.4% adults suffer from chronic rhinosinusitis, and out of them 8.1% fungal rhinosinusitis. That means 1 in 1,000 they acquired this infection which have been there. Finally, in case of mucor, as I have mentioned, that this is a very common disease in case of the Asia Pacific region, and we do see a lot of variation. First thing is that what we see is that it's uncontrolled diabetes overshadows everything. When you go to the Europe, we see that mucor is common in case of hematologic malignancy, in case of transplant group of patient. But in case of the Asian region, we see more in case of the uncontrolled diabetes. That is very important. Second thing, as I have already mentioned, so many new agents which are being common in this region. And then there are two diseases which is very commonly seen in case of Asian region. One in case of this, that is the renal mucormycosis. Young person, immunocompetent, suddenly have fever, flank pain, hematuria, anuria, and then you see this type of infected kidney. And this is a very peculiar disease. Why it's happened, whether it is genetically susceptible or not, is still not clear, but this is there. Similarly, in case of the China, in case of India, it had shown this type of farmers, they acquired this chronic cutaneous mucormycosis which is being there. Main problem in case of the mucor is that delay in seeking medical attention. Dr. Atul Patel is sitting here. He gave a leadership in conducting a multi-center study of mucormycosis in India. It had been shown that nearly quarter of the patient could not afford the therapy. So most of them must have died by this time, but we are not very sure. It's a big challenge in case of Asia Pacific region. And if you look into this amphotericin B use, it had been seen that in case of the Asian African region, still conventional amphotericin B, which is more commonly being used rather than liposomal amphotericin B or any lipid preparation. Whereas in case of the Western country, conventional amphotericin B, in case of Europe, you don't get it, this drug. In case of USA also, it is coming down. People are using more of the lipid preparation that is quite different from the Asian region. Of course, we had this particular outbreak, which I am going to discuss a bit when I am discussing in the main conference about the COVID-associated fungal disease. But this particular disease, the way it had happened in India is unprecedented. You see that within 1.5 months, we have seen nearly 50,000 cases of mucormycosis. And the same portal of government portal mentioned, possibly we have got very high incidence compared to this which have been reported. Some of these incidents in case of mucor, in case of our country is very high, we knew 70 times. But what it had been shown this time is a storm of mucormycosis, which had never been seen. And here myriad of hypotheses came first. What are the reason of this particular outbreak? A lot of people said industrial oxygen, environment, all these factors. Finally, we had conducted multiple studies and we could show it is mainly the issue of during the second wave of COVID, when plenty of patients came to the hospital, when the doctors were seeing the patient not only in the ward, they were seeing in the corridor or even on the pavement. During that time, they could not control the blood sugar. They could not look into anything other than try to save the patient of COVID. And that time, there was a crisis of oxygen happened. Because of the crisis of oxygen, they went on increasing the dose of steroid to save the patient. So instead of 6 milligram dexa, they have given even up to 30, 40 milligram dexa. Blood sugar had gone through roof, 700, 800 blood sugar which have been reported that time. So that was the major issue. And when we really did the campaign, we could control this particular disease. Just glimpse certain unique fungal disease in case of the Asia Pacific region. Already I have mentioned about the pitheosis. Pitheosis in case of Thailand is a very important factor. Of course, it had also been seen in case of Malaysia, India, China, Israel, in case of Asian country. And possibly we'll be having more discussion of pitheosis on different types of pitheosis which have been there. Trichosporinosis, these three countries where we see a lot of invasive trichosporinosis, especially in case of Thailand, Taiwan, and in case of Japan. Cladophilopora brantiana brain abscess. You see, I tried to review all the cases in the world, and we found that in case of India is very high in incidence. Even in case of immunocompetent patient, this particular fungus is being present. This is a very, in case of Australia, especially as I mentioned, the Scedosporium and Lematospora prolificans is very high. And here the outcome was very poor, particularly if it is Lematospora prolificans infection which have been there. This particular disease is very peculiar. Still, we don't know why it is happening. That is called severe fever with the thrombocytopenic syndrome. It initially started from China, then it had been seen in South Korea and Japan, and in this patient, invasive aspergillosis is very high. So you see that fungal infection in case of this Asia Pacific region is very high, but still the awareness was not so much. Their administrators were not paying much attention. We are at least lucky that in case of the WHO has started paying attention and they have developed this priority fungal pathogen list, and this had got 19 fungus which is being there. But the question always comes, where is the Aspergillus flavus in this list? Though I was in the committee, but the thing is that there was so few reports from this region that it was very difficult to push this particular fungus Aspergillus flavus. Possibly more data when it comes, it would be easier. So everyone has said that there is a major knowledge gap. We need to have the epidemiology of antifungal resistance in this region. So finally, in summary, what I tried to say in case of our Asian fungal working group is that prevalence of fungal disease is very high with unique spectrum of agent. We see certain fungus very uniquely here, like talomycosis. Of course, we are seeing histoblasto and emergomycosis. Among yeast, Candida tropicalis and the Trichospora ashayi, which is very important and seen in this region, high prevalence of Candida auris. Aspergillosis, real incidence we don't know, but Aspergillus flavus, which is prevalent in this area. Mucormycosis, where it is very high incidence, and you have seen that there are several new spectrum of agent which have been there, and there are several outbreaks, especially COVID-associated mucormycosis outbreak is very important. Outbreak due to rare fungus where affects large number of population, it was difficult to diagnose and treat. Pythium insidosum, which is one of the agent in case of Thailand, Scedosporium lamentospora in Australia, and black fungus in case of this India. However, awareness about this disease is still a bit important challenge, and there are few laboratories which have been there. So Asian Fungal Working Group is playing important role in this area by doing this training, education, and also conducting research and doing the networking. Thank you for your kind attention.